My name is Seelye, and my informative speech is about cancer. Cancer is the second leading cause of death in the United States. According to cancer.org, one third of people in the U.S. will be diagnosed with cancer in their lifetime. Today, we will explore some different types of cancers, causes of these cancers, and treatments that are offered for these cancers. My family has been affected by cancer in the past, and because of that, I've been inspired to do more research on the topic of cancer. Due to the fact that so many people are diagnosed with cancer in their lifetime, all of you more than likely know someone or heard of someone with cancer. And since we all know that cancer is the second leading cause of death in the United States, we need to acknowledge some of the different types of cancers that can cause fatality. With that being said, let's look at some common types of cancer that cause individuals to pass away. The cancer that causes the most deaths is lung cancer. This cancer originates in the lung tissues or the lining of the cells in the airway. Lung cancer is responsible for 29% of all cancer deaths. VerywellHealth.com states not only this, but that lung cancer is the most fatal cancer in both men and women. Colorectal cancer is the second deadliest cancer in the United States. Colorectal cancer is the cancer of the colon or rectum in the digestive tract's lower end. Over 50,000 people die each year from colorectal cancer. However, the new technological advances in the world are projected to make that death rate lower. Breast cancer is the third most fatal type of cancer. It is estimated that 41,000 people will pass away this year due to breast cancer. This estimate is projected based off the many deaths of previous years. Now that we have looked at some different types of cancers that can cause death, let's look at the causes of these cancers. Cancer can be caused by many things. Lung cancer is caused mainly by smoking. Nearly 85% of people who get lung cancer get it by smoking. However, this does not mean if you aren't a smoker that you aren't at risk for lung cancer. Radon exposure can also cause lung cancer and is the main cause of this cancer type in non-smokers. Air pollution, wood smoke, and cooking with poor ventilation are other causes of cancer, just less common. Colorectal cancer occurs when the colon's healthy cells develop errors in their genetic blueprint, otherwise known as DNA. It is not clear to doctors in most cases what causes this cancer, but they do know dangers that can increase an individual's risk factors for this disease. Other than heredity, components such as obesity, older age, and diabetes could increase the probability of getting colorectal cancer. As the cause of breast cancer is still unknown, doctors are aware of some risk factors of it. According to WebMD.com, if you are advancing in age or have a history of breast cancer, you are at risk. This does not mean that if you are considered high risk that you will get breast cancer, nor does it mean if you have no risk factors that you can't get breast cancer. Now that we recognize some of these causes of cancers, we have to have knowledge of the treatments that can be offered for them. So you may ask, what treatments are offered for these types of cancers? MayoClinic.org reveals that for lung cancer, treatment depends on what stage of lung cancer you may have. Treatments vary but may include surgery, radiation therapy, chemotherapy, radiosurgery, targeted drug therapy, and immunotherapy. The size, location, and how far the cancer has spread are all variables of how colorectal cancer can be treated. Surgery, chemotherapy, and radiation therapy are all typical treatments for colorectal cancer. And as I previously mentioned, the type of surgery necessary will depend on if you are in the early stage, the invasive stage, or the advanced stage. For some colorectal cancer cases, chemotherapy and radiation will be given together for the initial management of the cancer, followed by surgery. Similar to the treatments of lung cancer and colorectal cancer, breast cancer treatments also depend on the stage of cancer you may have. Radiation, chemotherapy, and surgery are treatments offered for breast cancer. If you are diagnosed with breast cancer and prefer surgery, you can either receive a mastectomy or a lumpectomy. A mastectomy removes the whole breast, while the lumpectomy removes just the tumor and tissues around it. To further understand what treatments are offered for other types of cancers, I suggest you do some research of your own. Today we have learned about the topic of cancer. We have gained insight on some types of cancers, causes of these cancers, and treatment options for these cancers. My personal experience involving cancer inspired me to engage into the topic of cancer. One final thought, even if you do not have any personal experience with cancer at this moment in time, it is beneficial to you and those close to you to be informed of cancer and to know about it.